Jody, I'm coming to you today from Capitol Hill in Washington, D.C. I had a chance to talk to some lawmakers yesterday. If they were to ask me about funding, and obviously that's what we talk about at the Concord Coalition is long-term fiscal sustainability. If money were no object, which we know it is, a lot of people think that the federal budget is infinite, but it is quite finite. But if you had to prioritize things to tell a member of Congress about your work and what we should be looking out for in future years, what would you suggest that I tell these members of Congress that I meet with?
Two things. We need to, I hesitate to call this a lull, but it's certainly a lull with COVID-19 compared to what it was, the last 3.5 years. What we need to do now is be practicing for the next big issue. And we need to be making sure our infrastructure is set up for fast delivery of whatever it is we might need. And we need a lot of pandemic preparedness. So we need those early warning signals need to be there. So that deep commitment to the public health infrastructure of this country is what we need to see, and what we were not doing well when COVID-19 hit. And that really set us behind from the very beginning.
Yeah, I mean, I think that you're sort of getting at this, but as a healthcare professional, looking back on these years, what do you think the lessons are from COVID? And not that I'm saying that it's over and done with, but what did we get right, and what should we learn for the future?
Yeah, so, I think a couple things that we got right. The vaccines are remarkable, and they were so much better than we anticipated. And they were so quickly developed in Operation Warp Speed. To develop them was a massive success. The communication around what that meant, maybe not quite as good as it could have been or should have been, and it did sow some mistrust. I think we had an undervalued, under-supported, and underemployed public health workforce at the beginning of the pandemic. And you cannot all of a sudden take on a tremendously large work with a pandemic if you were staffed to start with. And so we didn't have our state and local health departments in a place where they could handle what was going on. And, so that was a really big problem. We also had 50 different ways, at least, of putting the vaccines out. And so we all kind of acted like our own entity in the states. So it was really confusing at the beginning about how to get vaccines. The good news was the beginning, people wanted the vaccines, but the rollout did not happen smoothly everywhere. And so we certainly need to learn about that. But I think probably the two biggest things I would say, other than the lack of public health infrastructure, is the remarkable and rapid way miscommunication was spread. And it did not take very many voices for those to be multiplied by the millions by minutes on social media. And that is responsible for a lot of deaths and a lot of sickness, and including people that got long COVID. So that's a really unfortunate component of what went on. And then we already had a very inequitable healthcare system in the United States, and COVID-19, good news, made us talk about it more, but bad news, that inequity probably further divided during this pandemic.